Okay, now let us start with the next topic, which is X-ray films. X-ray films and accessories. And accessories. Okay, now what is X-ray film? Basically, X-ray film is the object which is used to record the information regarding the object, okay, through which X-ray is passing. So it just used to record the information, right? And X-ray film is just image receptor, okay, and this image receptor can be modified, okay, by using or by changing the composition of the film, okay, or by using the intensifying screens and grids. Okay, so these all are the accessories, okay, that we are going to study. Okay, so first we have two types of films that we use here. Okay, so first is intraoral films, right, and it is also called as direct exposure films. And second one, that they are screen films. Okay, now screen films are used with the intensifying screens. I will show you picture of intensifying screens. Okay, they are used with intensifying screen. Okay, and mostly these screen films which are there, they are used with the extraoral radiograph, right? Okay, now we have intraoral films. We have types of intraoral films. So first is your IOPA, which is intraoral periapical radiograph. Okay, and it has got sizes according to the site of the tooth which you are going to radiograph. Okay, so we have number 0 film, which is 22 into 35 mm. Okay, and it's mostly for children's. Then we have number 1, which is 24 into 40 mm, right, and it's for anterior region and for adults, right? Then we have number 2, which is standard. We use standardized IOPA, which we used in our radiology. Okay, so number 2 is 31 into 41 mm, and the site is posterior and also in adults. So these are the sizes of IOPA films that we usually use. Okay, then we have the second type, which is occlusal film, you can say. Okay, the size of it is 57 into 76 mm, and it is also called as topographical film, or bite film, right? So this is second type of intraoral film that we use, occlusal. Third one which we have is bite wing films. So wing films are basically used to detect the proximal caries that are there. Okay, and the size also differs, number 1 and number 2. Okay, so number 1 is 22 into 35 mm, This is for children's and posterior region. Okay, then you have number 1 film, which is 24 into 40 mm. It is for child, for anterior region. And here number 2 and one more is number 3. Okay, now number 2, the size is 31 into 41, adult, posterior. Okay, next is number 3. The size of it is 27 into 54 mm and it is adult anterior film. Anterior. Okay, so these are the sizes of bite wing films. Okay, now next thing that we have is screen films. I've already told you they are used with intensifying screens. I will show you the picture. Then extraoral radiograph. It's used with extraoral radiograph. Now the size of screen films varies and most commonly used is 8 into 10 inches. Okay, 8 into 10 inches. Now these screen films which are there can be blue light sensitive, and it depends on the composition of the film what it is consist of. So blue light sensitive, and next is green light sensitive. Okay, green light sensitive. Now blue light sensitive, the material used is crystalline calcium tungstate. Okay, so this is a material used for blue light sensitive screen film. Okay, next is green light sensitive, and the material used in this is rare earth materials. And what are those materials? First, terbium activated gadolinium oxysulfide. Okay, this is first rare earth material. Second rare earth is your thallium activated lanthanum oxybromide. So these are two rare earth material which can be used in screen films which are green light sensitive. Okay, now why these are called as rare earth materials? Not because they are very rarely found, but they are very difficult to extract from the ground or earth. Okay, therefore it is called as rare earth material, not that they are very rarely found. Okay, so just remember this. So we have studied this intraoral films, screen films. Screen films we have blue light sensitive and green light sensitive. Okay, green light may we have studied rare earth materials, right? So okay, so we have seen types of films, right? Now we will study the composition of film. Composition of film. Okay, now if you look at this picture, okay, you can see IOPA film. So this you must have used in your practicals. Okay, so IOPA films basically has layers. So talking from tube side, we have inner paper. Okay, we have dental film, we have inner paper wrap, again black colored, then lead foil backing. Okay, next is outer package, which is plastic, which is waterproof. Okay, So these are the layers which you find inside this IOPA film, and the size is numbers 2, what we usually used. Okay, so this is the composition of the or packaging of the dental film rather. Okay, now we will see the composition of film. Now composition, basically film is consist of the base. Okay, this is the base over which we have the emulsion layer. Okay, emulsion, right, over which we have the layer of super coat, right. This is super coat. Okay, now we are going to see the composition of each one. See, so we have base, we have emulsion, we have super coat. Now first is the base. Base is made up of polyethylene terephthalate. Okay, and if the base is made up of acetate polyester, okay, acetate polyester, okay, then it is called as safe film. Why safe film? Because it is not inflammable. This material, acetate polyester, is not inflammable, therefore it is called as safe film. Not inflammable. Okay, so base polyethylene terephthalate, if it is made up of acetate polyester, it is called as safe film because the acetate polyester is not inflammable. Okay, next thing that we have is, second one is the emulsion, which is very important. Emulsion is basically made of silver halide crystals suspended in gelatin. Now silver halide crystals can be silver bromide, okay, or silver iodide. Silver bromide is 80 to 99% and silver iodide is 1 to 10%. Okay, and plus we have gelatin. Now this gelatin is made up of cattle bone. Made of cattle bone. Okay, now why we have added silver bromide in because it adds sensitivity to film. Also it reduces patient dose. Okay, so we have got these silver iodide and silver bromide in the emulsion with gelatin. Gelatin is made up of cattle bone and there are silver iodide crystals also, which adds sensitivity into the film. Right, now third one that we have is the super coat. Now super coat is just a you can say coating provided for preventing any scratches. Okay, when we handle the film, there should be no scratches on the film, so that it degrades our image, our radiograph. So it just prevents or protects the film during handling. Prevent scratches Okay, so just remember this. Okay, now what we are going to study is the intraoral film speed. Now these are just you can say subtopics that we have seen composition of film, main, the covering of the film. Now we'll see what are the accessories that comes with these x-ray films. Okay, now first is intraoral film speed. Now what is intraoral film speed? It is a radiation, okay, radiation required to produce, okay, it is a radiation, amount of radiation which is required to produce good quality radiograph or radiograph of proper density, radiograph of proper density. Okay, now which are the factors on which this intraoral film speed depends on? Okay, so it depends on, basically depends upon, first, size of halide crystals, size of halide crystal. Second, thickness of emulsion, third, it depends on presence of radiosensitive dye. Okay, so intraoral film speed depends on these three factors. Now we have intraoral film speed from A to F, A being slowest, F being fastest. Okay, fastest means it requires less radiation, and because halide crystals are larger halide crystals. Okay, so F speed being fastest. And in dental radiology we use D or E speed film in intraoral radiography. Okay, so D and E speed films are used in intraoral radiography. Okay, then comes next entity, which is intensifying screens. Okay, now intensifying screens, if I tell you the composition of it or the positioning of it, okay, so here we have screen film. So you have the cassette, okay, extraoral cassette, into which we have to keep screen films. Okay, and on the both the sides of screen films there are white cardboard like paper, okay, which has been stuck. Now this works as a intensifying screens. Now how this actually works, okay, that we are going to see. So here, before going in this, I'll tell you, see, if you see this diagram, this is your cassette, extraoral cassette. So extraoral cassette, this is the film which you keep inside this extraoral cassette, and on both the sides there are intensifying screens which are being stuck. Okay, so these are screens inside which we keep film and we close the cassette and then take the radiograph. Right, now how this actually works, when you irradiate this cassette, okay, this cassette, what happens is X-ray will enter from here. Okay, intensifying screens basically contains phosphor layer. on both the sides. Okay, phosphor layer, here also phosphor layer. Now when X-ray enters, this phosphor layers is irradiated. Phosphor layers will create this visible light. Okay, and this visible light will expose the screen films. This is screen film. Okay, now the visible light which has been thrown out by this phosphor layer is taken up by this screen films, and then screen films gets exposed. Okay, now screen films, I've told you, depends on, or they have two types: blue light sensitive, green light sensitive. According to the composition they are made. Okay, so, and this you can say this intensifying screens are made up of composed of smooth plastic sheet coated with fluorescent crystals. Okay, these are called as phosphors. Okay, so these screen films, the intensifying screens, are made of a smooth plastic sheet, and it is coated with a fluorescent crystals called as phosphors. Okay, so this completes our intensifying screens. Then we have the next accessory is grids. Okay, now grids are the entity which basically reduces scattered photons that are being thrown out of the X-ray tube. Okay, so they reduces amount of scattered radiation, okay, reaching films. Okay, so I'll show you how the grid actually looks like. Okay, so this is a basic concept. This is the grid. Okay, when you expose, this is a patient. When you expose the patient, okay, so the x-rays come and it will pass through these grids. Now grid is basically the lead. Okay, these are the lead material which will stop or restrict these scattered radiation. The primary radiation, they let it pass. Okay, so example, this is the primary radiation, primary, so they let it pass primary radiation, but this scattered radiation which can cause fogging of the film, they'll restrict this restricted by this grid material. Right now, this grid material is, or you can use this grids. There are two types basically. First is stationary grid. Second one is your moving grid. Okay, so stationary grid and moving grid. Now why we are using moving grid here? Moving grid is also called as Potter-Bucky grid. Just remember this, Potter-Bucky grid. This is a moving grid, and when the grid is moving, there are less chances of getting the striations, okay, white or grid strips on the film. When we are using stationary films, there are grid strips that you can see on the film, but while using moving grid, we will blur out shadows of grid strips. Okay, we'll blur out shadow of grid strips. Okay, so what is the advantage of using moving grid? They'll blur out shadows of grid strips on the film. Okay, and what is the disadvantage of this grid? Disadvantage. So if we are using grid, exposure that is required doubles. Okay, using grid can also increase the exposure, right? Next thing that we have is the filtration. Now, as the name suggests, what do filtration means? Filtration just filter out. Now, when the X-ray radiation comes out of the X-ray tube, okay, when they are coming out of the X-ray tube, at the X-ray tube window there is a filtration placed. Now what is the use of this filtration? There are low energy photons and high energy photons both. Okay, so we just want high energy photons to come out of the X-ray tube. Now this filtration, what will it do? It will restrict the low energy photons that are trying to coming out with the X-ray. Okay, so it will restrict low energy photons. Okay, low energy photons, or you can also refer to it as unwanted radiation. Unwanted radiation just cause fogging of the film. It will not give any information to us. Okay, so filtration, basically we have two types of filtration. Inherent, that means we already have it in the X-ray tube, that is glass tube also works as a filter. Okay, but added filtration, we will add little extra thickness of particular material at the X-ray window. Okay, so that it becomes added filtration. Okay, so total filtration will become inherent plus added. Okay, and the filter material which is commonly used is our aluminium, and the thickness which is required is 1.5 mm. If your machine is working up to 70 kVp, 1.5 mm will do all the work. If our machine is working above 70 or higher voltages, we will add 2.5 mm of thickness more. Okay, so X-ray energies. Here I would like to mention one important point which is very important. X-ray energy most effective in producing image is 35 kilo electron volt and 55 kilo electron volts. So what is the range of X-ray energy that produces most effective image? Is 35 kilo electron volt to 55 kilo electron volt. Now if we use aluminium with rare earth materials like samarium, erbium, yttrium, and those two, terbium activated gadolinium oxysulfide or thulium activated lanthanum oxybromide that we discussed earlier, right? So if we use aluminium with rare earth material, the exposure is reduced by 20 to 80%. Okay, so if we use rare earth material with aluminium, the exposure is reduced by 20 to 80%. Okay, just remember this. Okay, now we are going to look at the collimation. Okay, the next entity that we have is the collimation. Now collimation basically controls shape and size of the beam. Okay, it controls shape and size of the film. Now it basically made up of lead, and we have 4 types of collimator that are commonly used. Okay, so first is diaphragm type. Next is tubular. Third is rectangular, and fourth is slit. Okay, now just remember, slit collimator is used in OPG. PG if you are going to study in detail, just remember slit collimator is used in OPG. Okay, and we prefer rectangular collimator over round. Now what is the reason behind it, I will tell you. Okay, now here if you can see, this is a collimator at the X-ray window, right? Now why we prefer rectangular collimator is our X-ray film, the size of our X-ray film, okay, size 2, they have mentioned here size 2, right? So it almost covers entire film. Okay, and the exposure, the scattered radiation or excess exposure is not coming to the patient. Okay, so excess radiation is getting restricted by using rectangular collimation. Now if we use round, if you see this round, the size of this round collimator is 2.75 inches. Okay, 2.75 inches, and the outline of size 2, you can see size 2 film is rectangular. Okay, so this black part what they have shown is the excess radiation which are coming to the patient. Okay, and we are not we will study radiation protection, principles of radiation protection, why we do not expose the patient to excess radiation. Okay, so this is the excess radiation that is been coming to the patient when we use round collimation. Therefore rectangular collimation is preferred over round collimation. Okay, so this completes our X-rays and accessories.